The last presentation of this afternoon or evening, Giulia, Max, and Linda. Giulia, Donia, we're talking about interdependencies between individual and collective resilience. And so came in my mind your presentation. So you were now with your colleague talking about a kind of societal resilience. In that case, the community resilience. We are wondering what you are telling us now. Giulia, the floor is yours.
Thank you, Harald. And thank you also to the previous speakers for their interesting insights, both on resilience and multi-resilience. So thank you very much for this opening. In the next few minutes, we are going to contribute to the discussion by furthering the discussion on community resilience that was already mentioned by Karim Fatih and also by Donia Gilan. So what we are going to do is also to show you some empirical results that we gathered in the framework of a case study that we conducted in the city of Merano in South Tyrol, Italy. So it has already been described, this concept. However, we would like to point out some aspects. First of all, yeah, community resilience is the ability of a community to take collective and action to remedy the effect of a problem, mitigate future events, and grow from crisis, what has been just described as bouncing forward. An important factor is also that resilience is not a stable trait, but it's a dynamic process. And being dynamic, it means that it can be learned and it can be fostered. So, for example, through policy making. Community resilience has very important implications for health and well-being of individuals and society, as it has already been pointed out. And the individual and collective well-being, of course, are very closely linked. They are closely linked, but it doesn't mean that community resilience or collective resilience is the sum of all individual resiliences. It is true, what Donia just said is that individual resilience strengthens collective resilience, but as I said, it's not the sum. It is this relationship between individual and community can be described as the ability of the individual to ask for support from the community, and it's the ability of the community to be able to address the individual's needs. In particular, we propose to mix the approaches that characterize the framework of community resilience and to decline them with the approach of post-disaster recovery. In particular, there's this framework which was proposed by Contreras. She is a post-disaster recovery expert, and she analyzed the case of L'Aquila city in Italy after the earthquake. Of course, in this case, that's been adapted to the health emergency and not to a natural disaster. But we found very interesting this approach of breaking down the concept in 6 areas that can be monitored and on which we can develop strategies to improve resilience. So these 6 dimensions are social aspects, so how people interact, which is an important factor both for individual and collective resilience. Cultural aspects, so how people access, for example, cultural places, museums, cultural events in general. Economic aspects, which is self-explaining, so how the COVID-19 has impacted the economy. Institutional aspects, which is related to trust in institutions, and physical aspects, also infrastructural. So in the case of a pandemic, of course, we are talking about hospitals, for example. And ecological aspects is, for example, the presence of green spaces, green areas, and so on. So the aim of our study was to investigate and identify which elements are strengthening community resilience in relation to COVID-19 and other possible future crises, such as, for example, climate change, based on the case study of Merano in South Tyrol. Why we chose Merano? So Merano, first of all, on the macro level is in Italy, and Italy in the Western world has been the country which was first and hardest hit by the pandemic at the beginning of 2019. On the meso level, it's located in South Tyrol, which is a very interesting area because it has a very high level of local autonomy, also in managing the pandemic response, the so-called Südtiroler Weg, which allowed for a faster and decentralized decision-making process, which is a risk, but it's also an opportunity. And finally, Merano within South Tyrol is very interesting because it has both factors that facilitate resilience. So for example, that it's a very multicultural city. It has a very high percentage of migrants. And also it's the only city in South Tyrol where German-speaking individuals and Italian-speaking individuals are present in the same percentage. Moreover, it is a city which is positioning itself as a health promoting city since the 19th century, and it was particularly interesting to investigate this context, of course, during the pandemic. But it also presents some possible frailties. So for example, a high presence of elderly, single households, and single parent families. So what did we do? We collected statistical data, both from South Tyrol and where possible for Merano. And then we tried to investigate some of the aspects that were coming out from the statistical data through qualitative interviews. So we conducted 14 interviews with the so-called key informants, which means experts from each of these dimensions in Merano. And we analyzed them with GABEC, which is a computer-assisted method in qualitative research. And moreover, for one particular aspect of the 6 I've mentioned before, so economy, we also conducted an online workshop to investigate particularly the sectors that were most impacted by the pandemic, which are tourism, trade, and the cultural sector. So now I give the floor to Maximilian for the selected results that we're going to introduce you.
Thank you very much, Giulia, for this introduction. As already mentioned, I want to present just some selected results that we thought would be fitting for today's webinar. These are the results of the qualitative interviews we did with the key informants. Beginning with the results or beginning with insights of the questions we asked about the social aspects of the community of Merano. In this context, we asked the interviewees about their associations or about their thoughts about how is the community of Merano, and also their thoughts about how resilient is the community of Merano. Always, of course, in the context of the pandemic or the coronavirus pandemic. Here on the left, you can see the so-called network graph that is produced by the program of GABEC, with which we analyzed interviews, and can be seen as a short summary, or it can be seen as a summary of all the dimensions or all the expressions that were mentioned together with this core concept of community. Here on the left in the graph, you can see that community of Merano was described as an open community and also as a diverse community. Giulia already mentioned that there's a high presence of migrants in town, which certainly favors this diversity and this multicultural element of the community. But nevertheless, there's also, there was mentioned this linguistic division within the community, within the city, between German-speaking and Italian-speaking residents, and this is also still very very felt. Culture was mentioned very often in the context of the community. Merano is a very cultural city. It has a lot of cultural offerings, and the community of Merano is very culturally active. That's why associations were mentioned. Also, associations in the town are there are a lot of associations in town, and these are meeting or chances for residents to meet, to get together, and to express their values, their traditions, their culture. Especially for young people who want to live up their traditions. The community, or in the context of the community, it was also mentioned that green areas play a big role. Merano is a green city. It has a lot of open spaces, a lot of parks, a lot of trees. And these are very important also for the community, because a lot of collective activities play in these green areas, in these open areas. And of course, in the context of the coronavirus crisis, there were also mentioned a lot of concerns or thoughts about the future. and a need for reflection, also for the community to stay together and also to stay together in the future as well. But I will talk about the future in a minute. What was interesting though is in the context of resilience, or when asked about how resilient the city is, the interviewees said that Merano is resilient, or at least has the possibility to be resilient. So in that case, they were very optimistic. Then in the context of economic aspects, on the next slide, we asked the interviewees how the economic sector handled the crisis, or how the economic sectors of the town were hit or were affected by the pandemic. And as you can imagine, it was hit very hard. The two biggest sectors, as Giulia already mentioned, are the tourism sector and the trade sector, so the trade industry in town. And both, or all sectors had to deal with a lot of restrictions, a lot of closures, restaurants had to close, hotels had to close, people were not able to go to work because of the pandemic. There were different ways to deal with this. We had a lot of some decentralized initiatives, and the town had to invent creative solutions in order to cope with these restrictions, in order to cope or to be still able to work a little bit, or to be in contact with the clients, with the audience. This especially also is true for the cultural sector, which is an economic sector which is forgotten quite often, but what was mentioned also in the interviews we did. And the cultural sector was also one that was hit very hard. Then going to the physical aspects of community resilience, we talked to people within the healthcare sector and asked them about the healthcare sector in Merano and how the pandemic, what kind of effects the pandemic had on this sector. As you can imagine, again, they had a lot of difficulties. They were not prepared for such an event. Also due to the fact that there's a lack of long-term strategy beforehand in order to cope with these events. There was a lack of digitalization, which would be needed in order to work against this crisis. There was also at the beginning a lack of collaboration within the healthcare sector. So different parts of the healthcare sector were not able to communicate. Slowly after time, obviously, this got much better. A positive aspect, or a positive thing that was mentioned by the interviewees was the will to help, not only within the healthcare sector. Healthcare workers, they're very eager and very hardworking. They worked over shifts or more shifts in order to help the people in need. But also within the society or within the community, people, non-professionals, were really keen to help their neighbors, their families, their friends. It was also mentioned that the corona pandemic is not only a health pandemic, but also a mental health crisis, and is weakening the social structure, especially also for the fragile parts of society, for example, young people. I mentioned the future already. Of course, in the context of the pandemic, the interviewees thought about the future and thought about how it's going to be, or how it's going to be in some years. On the next slide, I think we have a citation that kind of summarizes in some way what the people said in the interviews, but also in some way of what resilience stands for, what being resilient also as a community stands for. So is this learning from a lesson from this pandemic? So not only taking the negatives of this pandemic, but actively learning of the failures that happened in order to be prepared for future events such as climate change. The climate crisis was mentioned a lot, not only as as private individuals, as a community, as an administration, all together need to be prepared and need to be work together. These were some, very short selected results from our study. And I want now to go or give the word to Linda, who will proceed with insights from our representative study on South Tyrol. Linda, go ahead.
Well, thank you very much, Max, Giulia, and also thank you to the other speakers before me. I will just briefly, very, very briefly, since time is pressing and we still want to discuss what we did today, show you how insights generated from a representative study on the level of South Tyrol mirrors what has been said today. First of all, as everybody knows and has been said a lot, the pandemic represented a very big and difficult challenge on various levels. Life quality decreased, social contacts were missing, and a lot of people had to cope with income losses as well. Closure of schools represented stress for families, especially when the home office, kids at school, and other factors coming together and were bundled in one space. And however, if we look at the next slide, we also included in our survey, which is quite a big one with a sample size of 7,750 people, we can see that turning to the adaptation of people, there was quite a consistent level of resilience, as more than 75% declare to have been able to adapt to the pandemic situation rather easily or easily, which is quite a good indicator of resilience among the population. And similarly, also stress was able to be handled for 65% well, or rather well. So the question also was, why and how did people, in spite of all the negative aspects that they had to cope with, able to respond in such a good way, or in a way that didn't affect them very heavily on a psychological or existential level. So here we can see that coping strategies that were applied during the lockdown concerned lots of interpersonal aspects and matters, as phone contacts or sharing their worries, doing activities together, but also very practical ones as sports and movement, preparation and handiwork, or consuming less news and other aspects. And as we included also some qualitative questions in our survey, asking the reasons behind the answers given by the participants, we also found out that it's very the interpersonal things that mattered and that made overcoming the pandemic situation easier for most of the individuals and the families that responded to the study. And as you can see here, the time spent with the family and the loved ones was mentioned, as well as developing strategies to help each other stick together, find common solutions to problems, but also to foster communication strategies inside the family or with the close and loved ones, and to really reflect on what is important, the own privileges, and the security and essential things that become more visible and more visible in times of crisis. So also dedicating time to what is important seems to have been a factor increasing resilience among the population in South Tyrol. And as has been said by the other speakers, it is in fact true that crisis can be also a moment of reflecting and on what we are doing and getting better. They can be an opportunity. And in this case, this shows also what has been said before. And coming to the next and last slide, just to sum up our MERLIN projects, we can say that core elements that foster community well-being, in our case, have been shown to be easy access to nature on the one hand, but also the fostering of social projects and a broad cultural offer that can help people to overcome or to become more resilient as a collective, as a community, And of course, also adaptation skills and long-term planning strategies in the healthcare sector can be important. And of course, also the coexistence of different groups, minorities, and the interaction among them through, for instance, enhancement of neighborhood initiatives and projects, as well as on the social level, but also on the economic problem, can foster resilience to diversify and facilitate common approaches, community healing, and also more resilient mindset and culture. Having said that, I would like to say thank you again and give back to Harald for our last minutes of discussion. Thank you very much.